if you are a student from non-medical background and if you are planning to learn medical coding, watch this video until the end. In today's session, I will teach you how do you learn medical coding without a medical background. In this session, I will teach you what are the tips or steps you need to follow to become medical coder without a medical background. So, if you want to learn medical coding, first we need to understand what is medical coding. So, medical coding is the process of translating provider diagnosis into standardized medical codes or standardized codes. So, think like that. So, in medical coding, we have healthcare topics. You need to use the logics, you need to use the rules, and you need to have the skill of attention to detail. So, surely medical coding does not need biology, not nursing, not bedside care. You need to have good logical skills as well as you need to have the capable of knowing the rules as well as you need to have attention to detail. If you want to become medical coder, you don't need to master all medical things. Just you need to know the medical basics. So basics are very important for medical coders. You must need to be focused on basic anatomy like organs and systems, and you need to master medical terms like prefixes and suffixes, and you need to master common diagnosis as well as procedures, which you will get the information on Google. You don't need to worry. After joining the job also, you can search for basic anatomy, medical terms as well as diagnosis and procedure using the Google. Okay. So if you want to learn these basic anatomy, common medical terms, common diagnosis and procedure, Google is the first priority. Then you can learn the books like Medical Terminology for Dummies, AAPC Medical Terminology course, where you will become master if you take AAPC's Medical Terminology course. So what is the goal of these steps? Understand notes, not treat patients. As a medical coder, you need to understand the note. Okay, so we are not going to treat the patients. So if you want to learn medical coding, you need to master in 3 core coding systems. What are they? First one is ICD-10-CM. Mostly we will use ICD-10-CM diagnosis codes for why the patient was seen, or reason for the encounter, or reason for the procedure. Okay. Next we have CPT, what the provider did. So this is the condition why patient has admitted to the hospital. Next one, what physician did. Using the CPT, we will code what physician did. And also in the inpatient setting, we will use ICD-10 PCS. Next, ICPICS level 2. So here, physician has performed one procedure. So if the patient wants to perform that procedure, he needs supplies, DMEs, injections and medical items or Medicare items, which will comes under ICPICS level 2. Okay. So just you need to learn like this. First you need to learn ICD, then CPT, then ICPICS. Okay. For example, if you learn only ICD, you can enter into medical coding. As if you know or not, SEC coding uses only ICD-10-CM codes. So if you master in only ICD also, you can get a job. Okay. So if you want to go advanced medical coding specialty, you need to learn CPT, where you need to code procedures related to major conditions. Next, sometimes you don't need to worry about ICPICS. You need to know little background about ICPICS coding system. So in medical coding, our motto is to learn guidelines, not memorization. So here, you don't need to memorize anything. So everything is included in your books like ICD-10-CM, CPT code book as well as ICPICS coding book. So just you need to know what are the guidelines and where they are located in those books. So first step is you need to choose the correct certification or right certification. Okay. For example, if you want to become outpatient coder, you need CPC certification, which you will get from AAPC. For example, if you want to become inpatient coder, so CCS certification, and you will get the certification from AHIMA. And also, if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And also, if anyone looking for same-day surgery coding training, IPDRG training, SEC training, CCS certification training, please send WhatsApp message to 707-526-3939. What is the step 5? Use official and trusted learning resources. Okay. So you don't do courses from the unauthorized institutions. You need to learn industry recognized platforms. So for example, if you want to become outpatient coder or inpatient coder, you will get certification or medical coding trainings from AAPC. Okay. For example, if you want to learn CPC or if you want to write CPC, you will get the training from AAPC. So you need to master practice exam by AAPC and you need to master official guidelines as well as the books. For example, if you want to become inpatient coder, so you can take the certification prep from AHIMA and here you will focus on hospital coding. Okay. So what is your bonus learning? If you want to learn free medical coding, you can watch FastCoder 21 medical coding YouTube channel. Next, practice like a real coder. So if you want to practice real coding chats, code real medical coding scenarios. Okay. So try to practice E&M leveling. If you don't know how to do E&M leveling, please mention in the comment section of this video. I will create videos related to E&M leveling. Okay. So try to read real provider notes. So take help of your friends and read the real provider notes. Okay. And also try to understand the denial reasons. If you don't know denial medical coding, please check in FastCoder 21 YouTube channel. We have more videos related to denial. So the tools which you need are AAPC practice exams, coding workbooks as well as pre-CMS guidelines. You need to master medical coding if you are a non-medical background. Next, you need to follow compliance and guidelines. Okay, so basic truth is good coders follow rules, great coders avoid audits. So why they will avoid audits? So basically they will master these rules. Okay, so if you want to avoid audits, you need to master official coding guidelines, you need to master NCC edits, you need to master modifier usage and you need to master medical necessity. You don't need to worry, all these videos are created on our YouTube channel FastCoder 21. Okay, so employers love compliance aware coders. So if you know the compliance related topics in medical coding, employers will love you. Okay, so step 8, get ready. So no experience, no opportunity. So if you don't have any experience, you will not get the opportunity. So how do we get the experience? Apply for CPCA roles. So CPCA means apprentice roles and try to join in internships as well as external tips. Okay. So and try to join entry level coding, billing hybrid roles. So where in hybrid roles you can code both coding as well as billing. Okay. So remote audits and QA trainee roles. You can apply these roles also if you want to become medical coders. Usually most of the coders start in billing and then they move into coding. Okay. So reality check is it's not easy money. So it requires consistency. If you want to become medical coder, it requires consistency. It is stable, remote friendly and in demand. Okay. So non-medical backgrounds succeed all the time. Okay. So if you have any questions, you can mention in the comment section of this video. And I have a quick question for you. Are you from a non-medical background, already studying coding, certified but job hunting? Please mention in the chat box of this video. So I will provide good suggestion related to all these areas. And also if you like this session, please click on like button in order to create more videos like this. And also if anyone looking for medical coding jobs in UAE, USA and India, please join our WhatsApp group. Group link is in the description of this video. Our training will be same day surgery training, IPDRG, SEC as well as CPC certification training. So if you want to learn these trainings, 707-526-3939 is the contact number.